Dementia is a term that describes a group of symptoms caused by diseases affecting the brain. The most common causes are Alzheimer's disease, vascular dementia, Lewy body disease and frontotemporal dementia. But there are also many other causes. Dementia can have a big impact on your family life, your social life and your working life, because over time it can affect your memory, communication skills, doing everyday things, concentration and motivation, mood and behaviour, judgment and the ability to plan. Dementia is not a normal part of ageing. However, the chance of developing dementia increases with age. Among Australians aged 65 and over, nearly 1 in 10 has dementia. Dementia is often described as having 3 stages. The milder early stage, where you may notice changes with your memory or with some everyday things, but you can still do most things with a bit of help. The moderate or middle stage, where your difficulties are becoming more obvious and you may need more help to stay living at home. And the severe and late stage, where you'll need care and support from others.
There are 2 types of strokes. One type of stroke is called an ischemic stroke, and an ischemic stroke occurs when there's a blockage to a blood vessel in the brain, and this disrupts blood supply getting to the brain. The second type of stroke is called a hemorrhagic stroke, and this occurs when a blood vessel in the brain bursts, and again this interrupts the blood supply getting to tissue in the brain. Ischemic strokes occur in about 80% of strokes, and hemorrhagic strokes occur in about 20% of strokes.
There's still a lot of debate about how stroke causes dementia. A series of strokes and changes to the small vessels in the brain can lead to memory and thinking problems. This may be the start of vascular dementia or other conditions such as Alzheimer's disease. Brain cells can quickly die if they don't get the supply of blood they need. For some types of stroke, getting the right treatment straight away might be able to keep some of these brain cells alive. The National Stroke Foundation recommends using the FAST test when you suspect someone is having a stroke.
To spot a stroke, think fast. Check the person's face. Has their mouth drooped? Can they lift both arms? Is their speech slurred? Do they understand you? Time is critical, so call 000 straight away. Think fast. Act fast.
Coronary heart disease affects the blood vessels that take blood to the heart muscle. The cause of coronary heart disease is a slow build-up of fatty deposits on the inner wall of the blood vessels that take blood to the heart. These fatty deposits slowly clog the arteries and reduce the flow of blood to the heart. If the blood flow is not restored quickly, ideally within 90 minutes of the first symptom, the damage to the heart muscle may be permanent. In many cases, the first sign that someone has coronary heart disease may be a heart attack, which is why it's important that people have a heart health check with their doctor to identify risk factors early, such as high blood pressure, and take steps to reduce their risk through lifestyle changes and medicines. Another sign of coronary heart disease is angina. Angina is pain that occurs when there's not enough blood or oxygen going to the heart muscle. Angina pain that fades away with rest or by the use of angina medicine does not result in heart damage. The warning signs of a heart attack can be different from person to person. Heart attacks are not always sudden or severe. Many heart attacks start slowly with only mild pain or discomfort. A heart attack can show as discomfort in your arms, shoulders, neck, jaw, and/or back. You may have a choking feeling in your throat. Your arms may feel heavy or useless, or you may have chest pain or tightness. People who have a heart attack usually have some warning signs, but many people wait too long before getting help. If you or someone else experiences warning signs of a heart attack, this is an emergency. Call 000 and ask for an ambulance.
There is no single cause of dementia, stroke or coronary heart disease. The link between these 3 conditions is vascular risk factors, that is, things that can cause damage to the blood vessels, which can lead to blood vessel disease. Many things can harm blood vessels. High blood pressure, especially in your middle life, is the most harmful, but this is treatable. Other risk factors you can influence include diabetes, smoking, high cholesterol, being overweight or obese, unhealthy teeth and gums, depression, too much alcohol, poor diet and a lack of exercise, even social isolation. The first step to lower your chances of getting dementia, stroke or coronary heart disease, but equally to manage these conditions where they already exist, is to get on top of the risk factors. This may be done through the use of medicines, but it can also be done by living a healthier lifestyle, keeping active, being social and eating well.